This is KPPQ LP Ventura, 104.1 FM, and we're in the Women's Room, where we appreciate and support each other. I'm your host, Kathleen Good. Women have special health and medical needs. Probably no one could actually disagree with this statement, but there are ongoing attempts to control women's reproductive health and to undermine women's health issues in many small and quiet ways, like reducing insurance benefits for practitioners or only allowing partial coverage for some therapies, by withholding coverage for contraceptives, or by cutting Medicaid for poor women who get their reproductive health care through Planned Parenthood. Perhaps those in public service with the power to make laws or to influence insurance companies simply do not know enough about women's pelvic health issues, because it's a subject many do not feel comfortable talking about. Women are embarrassed to even mention issues like bladder leaks, and guys just don't want to know. We here in the Women's Room feel more education on women's pelvic issues is needed. So to begin to remedy this situation, I've asked Dr. Jen Ballentine Evans, Doctor of Physical Therapy and Women's Health Clinical Specialist, here to talk about women's pelvic issues. Hey, and no switching to another station, guys. You need to hear this stuff too. Dr. Jen Evans holds a doctorate in physical therapy, has taught in her field, and has been in private practice for 14 years. She is the only board-certified physical therapist in Ventura. Hi, Dr. Jen. We're so happy to have you here with us today.
Hi, thanks for having me.
Well, before we start with many questions, let's have you tell us a little about your extensive credentials and background. Now, why did you choose physical therapy as a career path?
Well, I graduated from physical therapy school in 2006 with a doctorate, and I got a board certification in women's health physical therapy in 2011 and opened my private practice in 2011. And I was really drawn to physical therapy. I definitely wanted a career in healthcare. But as I followed other healthcare practitioners, it just seemed like they didn't have a lot of time to spend with their patients anymore. And they were running from room to room, and it just felt like they couldn't really get to know people or really feel like they were helping them. And I just loved that in physical therapy, you got to really spend time with someone and watch them progress and see them get better. And that really spoke to me.
Why did you decide to do a doctoral program, a DPT? And what special skill knowledge did your postgraduate work give you to help women?
I wanted a DPT because there was a goal in the field of every new graduate physical therapist being a doctorate of physical therapy by 2020. So I focused on just applying to programs that had a DPT because I really wanted to get that degree just right away and not have to go back to school. And our program at Mount St. Mary's was great because we had a 6-week class in women's health physical therapy that a lot of schools didn't offer. So I got a great introduction to women's health and pelvic health physical therapy, and I loved it right away. And then after finishing the class section, I did a 12-week internship with my professor and continued to love it and have taken many, many Con Ed classes since then.
Well, many women don't even know that physical therapy and body education can improve or eliminate pelvic pain, improve or eliminate bladder leakage, and many other issues. They suffer in silence because they don't want to talk about problems that are embarrassing, or they don't even know something can be done for them. Should women feel embarrassed? Do they need to suffer in silence because they believe that nothing can be done?
They should never suffer in silence, and there's always something you can do. It takes women an average of 6 years when they start having symptoms to talk to their doctor about it. Wow,
I didn't realize that. What are some of the most common reasons for pelvic pain or dysfunction of the pelvic organs?
Some of the reasons can be pelvic floor muscle spasm, endometriosis, pelvic organ prolapse, joint dysfunction in the SI joints, tailbone dysfunction, hormone issues, or injuries that happen during childbirth.
So could you just give us a little layman's definition of endometriosis?
Yeah, that's the condition where the tissue on the inside of the uterus is growing on the outside of the uterus. It can really be anywhere depending on where the stage that it's at. But it often causes really painful periods and pelvic pain and a lot of tightness.
So women have special needs at every stage of life: teenage, reproductive, childbearing years, menopausal years, senior years. Let's start with childbearing. Many women in childbearing years suffer from menstrual pain, such as cramping. What are some of the causes of pain related to menstruation, and what can be done for a woman who suffers with monthly pain?
Well, I would just encourage anyone that suffers from painful periods to tell their doctor about it. Make sure that they're not just feeling like they have to suffer through it, because they do want to be checked to make sure they don't have endometriosis. There's ways for treating these kind of things, and sometimes they get progressively worse with time.
So many women just don't bother to tell their doctors.
They just think, oh, I'm having really bad cramps. It runs in my family. I don't need, I just need to suffer. But they should really tell their doctor about it and be checked for endometriosis.
And are some of the treatments for endometriosis, are they, like massage or medication or what?
Yeah, so a lot of the times when I'm seeing somebody with endometriosis, they've developed secondary issues because of it. So maybe they have muscle spasm in the abdomen, in the back, hips, pelvic floor. So treating them with massage or stretches, giving them some pain management techniques, teaching them stretches they can do at home when they're on their period, some strengthening exercises they can do in between periods to prevent it from happening, breathing exercises, and then, letting them know about using heat or cold for pain management. So
they don't necessarily have to have surgery or take heavy-duty medication, because I know a young person who she has, chronic menstrual pain, and she won't do anything about it.
So I think a combination of the physical therapy with medical care is important, because they can decide what the best sort of internal treatment is going to be for you. And then physical therapy can help to address the secondary tightness and pain and things that happen with endometriosis. So manual therapy, massage, stretching. But then there's also visceral therapy, which people haven't heard of, which is a technique where you release the fascia around the internal organs. Because a lot of the times the body tries to protect itself, and the fascia around the organs gets very tight, and that can cause pain as well.
So the organs can't move.
Yeah, everyone wants a little wiggle room inside the abdomen, and when everything gets really tight and there's holding patterns, it makes the pain worse. And it can also keep the pain even when the person's not on their cycle, still having pain all the time.
Oh, my goodness.
Yeah.
So there's sort of a myth in the culture that childbirth is a natural process and women can just sail right through it. But this isn't always the case, is it?
Nope. 50 to 80% of pregnant women will suffer from back pain at some time in their pregnancy. And physical therapy is really, really important for addressing back pain. It can be very debilitating.
So when we talked earlier, you mentioned that in European countries with health coverage for all, postpartum pelvic floor care by physical therapists is considered a necessary part of the entire childbirth care process. It's
an automatic coverage that they get pelvic physical therapy after having a baby.
Oh, wow.
So it really helps with rehabbing the body. Here in the U.S., you get one appointment at 6 weeks, and, everyone's focused on the baby. In your life, people aren't necessarily focused on you, and the doctor, does a quick pelvic exam and says, okay, you're cleared to have intercourse, go back to exercise, whatever you need. And that's really the last time you see your doctor unless you're having an issue. So they're doing a good job at screening now for postpartum depression, but I think we need more screening on musculoskeletal problems and things that can develop postpartum.
Right, and I imagine if you have some issues that aren't cared for when you're young in the childbearing years, later it compounds or multiplies into other issues.
Yeah, if you get a strain on the body, and then when you go through menopause and your estrogen goes down, it makes your tissues thinner, and it can bring back up some of these issues that happened during childbirth.
Wow. Good to know stuff. So the reproductive years require very special care. Now, how can you, as a physical therapist, help with the pregnancy?
Well, I think too many women are suffering with back pain during pregnancy, and they should really speak up to their doctor if they're having pain, because it's going to start affecting their work, taking care of other kids, and just, their ability to sleep. And it's kind of like a cascading effect of negative things that can happen with back pain. But it's normal to have the hormone changes in pregnancy that allow your ligaments in all your joints to become relaxed. And they need to be relaxed because you need your pelvis to open to get the baby out. But because of this joint laxity, the muscles have to work extra hard to hold the body up. And especially as you gain weight and your abdomen grows and your breasts grow and your center of gravity changes, it puts a lot more strain on your spine. So just kind of educating women about these natural and normal changes and maybe why they have more aches and pains in pregnancy. But then there's just a lot of things we can do about it to make it more comfortable and help support people and strengthen them so that as their joints get more relaxed, their muscles are doing a better job of holding them and not just going into a spasm or having pain.
So, could you actually help somebody? Their center of gravity has changed. What do you do? Help them find a new center of gravity?
Yeah. Strengthening exercises to help the body be more comfortable with the changes. So a lot of core strengthening, lower body strengthening. And then, breathing is also really important for not creating too much pressure in the body. And sometimes the breathing gets limited because your diaphragm is being pushed up by the baby and your ribs are being opened, and the excursion of the ribs is not as great when you're pregnant. So there's a lot of different things that can be done in physical therapy. And then just, soft tissue releases of the back muscles and other areas that are tight just provide so much relief in pregnancy.
So I don't know if this question is redundant or not because you've talked about it, but what do most women not know about pregnancy and its effect on the structure of the body? And what is the most common misconception about pregnancy?
So I think the important thing is just knowing that the hormone changes that are going on are normal and they cause ligament laxity, and the muscles have to work harder. So it's a really great time to stay strong. It's hard to keep exercising when you're feeling sick for the first trimester. Right. It's hard to get your energy up, but the more you can exercise and keep your body moving, the healthier it's going to be. Also, the common misconception is that back pain is normal and you kind of just have to suffer through it, and that's just not true. There's a lot of things that can be done for back pain.
Right. A woman actress who's pretending to be pregnant, they're always holding their backs. I guess because they've seen it.
Yeah.
So let's move on to incontinence. Now, is incontinence correlated with age?
It is. So let me give you some statistics on incontinence.
Okay.
25 million Americans suffer from incontinence. 75 to 80% of those are women. 1 in 4 women over the age of 18 have episodes of urine loss.
That's pretty young, isn't it?
Yeah. 50% of women over age 60 have incontinence. So it is a huge problem. It is correlated with age in that as your hormones, or as your estrogen decreases and your hormones change, the tissues get thinner everywhere, but especially in your pelvic floor. So the muscle mass is less and it's harder to feel stronger in your pelvic floor as you age. And the estrogen gives sort of a plumping effect to the pelvic floor. So when that estrogen is not there, you get that thinning and that atrophy, which can contribute to feeling like your bladder is weak.
So why are women developing incontinence in their 20s?
I think it's a trend right now for women to overtrain and be really aggressive in their training, like such as gymnastics, putting a lot of pounding and stress on their pelvic floor. And I think there's a trend towards overtraining for weight training too. And you're seeing a lot of CrossFit gyms, and it's becoming normalized to leak urine when you're weight training. And that just doesn't have to be the case. If you're leaking urine with weight training, that's just your body's way of saying, this exercise is too demanding for the strength that I have right now. So I think we need to let women know leaking is not okay. And if you are leaking with exercise, you need to modify that exercise so that your body isn't receiving all that pressure.
Okay. Well, we're going to have to leave it right there and do a station break. This is KPPQ LP Ventura, 104.1 FM, and we're in the Women's Room, where we appreciate and support each other. I'm your host, Kathleen Good. I'm talking today with Dr. Jen Ballentine Evans, Doctor of Physical Therapy and Women's Health Clinical Specialist, who is here to talk about women's pelvic issues and to put a face on the special medical needs of women. And we're back, and we were talking about that subject that no one likes to talk about, incontinence. But I was wondering if you could give your listener a simple exercise or two which might help prevent urinary incontinence.
Sure. So, you hear a lot about Kegels these days, and I just wanted to kind of talk the listener through how to do a correct Kegel, because the research shows that 40% of people do a Kegel incorrectly when asked to do so.
Uh-huh.
So when you're doing a Kegel, you want to imagine that there's a marble in your vagina, and you want to grab that marble and you want to pull it up into your body.
Oh.
And then you want to release the marble and drop it completely. So that would be a full contraction.
Uh-huh.
Ways that people do a Kegel incorrectly would be to squeeze your glute muscles or your leg muscles, over squeeze the abdominal muscles, hold the breath, or push down instead of pulling up.
Mm.
So if you imagine you grab that marble and pull it up into your body and then release it completely. Simple things you can do to really help with incontinence is just kind of being mindful of when you're having the symptoms. So let's say you're somebody that has stress incontinence, which is when you leak urine when a stress is put on your body, such as coughing, sneezing, lifting.
Mm-hmm.
Such a simple thing you can do is contract your pelvic floor muscles and do a Kegel before you cough or before you sneeze, so that you're preventing so much pressure from going down onto your bladder.
Oh.
And that will cut down on the leaking right away, but also train your body that it should be doing that contraction before you cough or sneeze automatically. Sometimes as we go through pregnancy, childbirth, hormone changes, that reflexiveness of the muscle is diminished.
Uh-huh.
So we want to right away decrease the symptoms, quick Kegel before you cough, sneeze, laugh, or lift, and then train that body to do it naturally.
So you should be actually drawing up.
If you feel like you're going to cough,
Uh-huh.
grab that marble, pull it up into your body, and hold it before the cough comes. You're kind of bracing your bladder against the force of the cough.
Well, that's a really, really useful exercise.
Good.
I thank you in the name of our listeners for that. Okay, well, let's move on a little bit. What part does movement play in keeping the body balanced? I know we've talked about this somewhat, but there's a lot more. It's the imbalance of body structures that causes weakness and possible pain, right?
Yeah, the body wants movement. It craves movement. When you move, you have joint lubrication, you have circulation, stability, and flexibility. And, there's a balance in all those things that keeps the body feeling good. And if you have something going on that limits your movement, then, it's not lubricating that joint as well. You're not getting as good of circulation. And so it's important to address some of these things. But, when you're taking care of a baby and focusing on the baby, sometimes you put your needs, but there's a lot of things that can happen postpartum that physical therapy works great for, such as pelvic floor dysfunction, like what we were just talking about, either with leakage of urine or feeling pelvic pressure, maybe from a prolapse. A lot of women develop upper back pain postpartum because they spend so many hours a day nursing or feeding their baby, rocking, things like that, and maybe they're not focusing on their posture and their upper back is curving.
They're looking down at
They're
the
looking
baby.
down at their baby, they're looking down at their latch, and then they feel that strain in the upper back. Also how much bending and lifting you have to do when you have a new baby. So a lot of women will be fine in pregnancy and then develop low back pain postpartum. And then just, core weakness and the need to rehab the core and the pelvic floor muscles from the birth process and just from being pregnant, no matter what type of birth you had.
Mm-hmm. So are there strategies that you can give women to regain their skeletal alignment, tone, and inner core strength?
Mm-hmm. So just generally, as much as you can, use pillows to support yourself, because posture is very, very important to rehab the body postpartum. But you can't really think about sitting and standing perfectly straight all the time when you have all these responsibilities. So use pillows to help you. If you're going to sit, put a pillow behind your lower back. Make sure that you're sitting to the back of the chair or the couch so that you're not slumping. Sit and stand as tall as you can, and then the body's going to stack on itself and have less of a strain on it. So continue to use pillows postpartum. Also with sleeping. A lot of times we use pillows for support with sleeping in pregnancy and then feel like we just get rid of them when the baby comes. But still use those pillows between your knees when you're sleeping side lying, just for that alignment of your body. Just because the baby comes out doesn't mean your body just is completely back to normal right away.
Right.
There's still that huge hormonal impact and then all the stress of taking care of a baby on your body. So it takes time to recover. We need to, be gentle to our bodies.
Yeah. So the pelvic problems don't end with childbearing years. We don't have a whole lot of time, but let's just touch on the type of symptoms that postmenopausal women experience.
So a lot of times the postmenopausal issues are hormone related. They'll start to have painful intercourse, vaginal dryness, prolapse symptoms, leaking, or overactive bladder becomes really common too.
Why would overactive bladder become common?
One of the reasons is because if you have pelvic floor muscle weakness or thinning, it can be harder. You can feel more symptoms of the urgency to urinate.
Okay.
And then women who are having leaking sometimes will restrict their liquids because they think, oh, I don't want to leak. Let me not drink water. But then that urine gets very concentrated in the bladder, and that can be irritating to the bladder too and make the woman feel like she has to go to the bathroom all the time. So there's a balance in drinking enough water, but not too much.
So how does having urinary incontinence, perhaps uterine prolapse, again, all the conditions we don't even want to think about, but how do these affect a woman's life, her self-confidence, her physical ability to live fully and actively?
That's the worst part. A lot of these women that I see limit their social activities. Sometimes they don't even want to leave the house because they feel like they need to stay close to the toilet. They have a fear of odor. They might limit their exercise or their physical activity. And then, like I was saying, limiting their water intake, that's not good.
Right.
So there's a lot of ways that these issues can impact a woman's quality of life.
Right. It just seems to compound.
It does, yeah.
And probably these are the things that people feel are what aging is.
Yeah. Also, just the expense that people are having to go through buying like pads and Depends and other, these things get very, very expensive.
Okay. In this time of Me Too, and a time when women are continuing to seek true equality, one hates to even mention that women may not be as strong as men, at least in one area, the pelvic floor. Women are not as strong. Why is this?
Well, men have a prostate, and that prostate acts like a cork in a bottle. So it provides another closure mechanism from the bladder to the urethra. So men usually don't have issues with leaking until they get that prostate removed and they lose that cork in the bottle, and that's when they start having issues. But urinary incontinence is twice as common in women than men. Women also have a vagina, so there's a space in the body that men don't have, and pelvic organs that are more flexible or more mobile can fall into that space and become symptomatic as well. And then also women, experience pregnancy and childbirth and menopause, and those are major reasons that there's more incontinence in women than men.
So women kind of have to take more care.
Yes.
Just mentioned men also can become incontinent. And, just talk a little bit about this subject, and maybe can help some men.
Sure. So especially in situations like prostate cancer, if they have a surgical technique, then there can be some incontinence post-surgical. And physical therapy, of course, works great for men too. So they might not have ever had to think about contracting their pelvic floor muscles prior to having prostate cancer, but now all of a sudden they do. And physical therapy treatment works great for them too.
So some women seem to have fewer problems with pelvic floor strength. What do you attribute this to?
You know, I think there may be a genetic component to people's tissue structure, but I think that constipation is a huge, huge factor for pelvic floor dysfunction, even in young women. Constipation puts such a strain on the pelvic floor muscles and the pelvic organs, and it's a repetitive strain. So, you think about childbirth as this one really straining event. But if you think about somebody that's constipated every single day, these things are repetitive stress injuries, repetitive strain things. So I think constipation is a huge area that we need to improve in people's lives to prevent pelvic floor dysfunction in the future.
And do you get referrals for
Yes.
people and work with them?
Yes, absolutely.
And is this a matter of, exercise?
It depends on the person.
Food
It really, it's kind of an investigation, but it depends on the person. There's a lot of different things you can look at: fluids, foods. Are the pelvic floor muscles relaxing appropriately? Can the patient be in an optimal position for a bowel movement? Different techniques for improving the ease at which the bowels move. And then, I talked about the visceral physical therapy in the abdomen that can really help improve the motility of the colon. So there's a lot of things that we can do for constipation. And then, we're just preventing all that strain later in life on the pelvic floor muscles.
Right. Well, we're going to have to leave it right there. Thank you so much, Dr. Jen Ballentine Evans, for coming in to educate women and men about pelvic pain and talk about the things we're so reluctant to discuss. This is KPPQ LP Ventura, 104.1 FM, and we're in the Women's Room, where we appreciate and support each other. I'm your host, Kathleen Good.